Hello everyone. Today we're going to talk about preparing for breastfeeding during pregnancy. But before we start, please note the disclaimer. Okay, so the objectives for today, hopefully by the end of this talk, you will be able to name 5 things to help you prepare for breastfeeding, know which things will help or not, and where to seek help if needed. So research shows that the best feeding option globally is the initiation of breastfeeding within the first hour of life, exclusive breastfeeding for the full 6 months, and then safe, age-appropriate and adequate complementary foods from 6 months, and continued breastfeeding through the second year and beyond. Now, in It Takes a Village, this is a publication by Paige Smith and Miriam Labok, we read, no woman can be expected to breastfeed unless she's enabled by unbiased information and complete support to decide to breastfeed and is then given all support she may need to achieve her breastfeeding goals. So it's not just the mother's responsibility alone, but all healthcare professionals and community clinics, pharmacy clinics, community as a whole, your family, your employer, your government, we all have a responsibility to support and protect breastfeeding. Now, keeping this in mind, what can you as a pregnant mother do to prepare for breastfeeding? Did you think we were going to discuss a list of stuff to acquire to help you breastfeed? No, I'm just joking. The list is coming, though it is a very short list. So the best preparation and what most women need in order to breastfeed, apart from a baby and breasts, are accurate information and someone to provide support and encouragement. So let's take a look at each of these points. So first off, what is your dream for breastfeeding? What are your breastfeeding goals? So goals provide a sense of direction, like milestones to help you achieve your dream. For example, my dream is that I want to breastfeed my baby for at least 2 years. And by setting goals, I provide myself with targets to aim for in order to reach my goals. For example, one of some of my goals could be I will make contact with a lactation consultant between 28 and 35 weeks for an antenatal chat to help me prepare for breastfeeding. Or a goal could be when my baby is born, immediately after birth, I will hold my baby skin to skin for at least an hour or until my baby is self-waking and feeding well, even if it takes 5 days. Or should my baby have any latch or feeding issues during the first week, I will ask help from, and ideally this would be someone trained in breastfeeding support. So it could be goals like that. So to help you with your breastfeeding goals and to reach your breastfeeding dream, you can download a sample breastfeeding plan from the link below. Okay, also to help you reach your breastfeeding goals, please think of what is your idea of successful breastfeeding. So it could be breastfeeding baby exclusively, it could be breastfeeding and giving top-ups, it could be exclusive pumping and giving baby expressed milk. But at the end of the day, each mother needs to decide for herself what she sees as successful breastfeeding. Though it needs to be an informed decision, and this is where educating yourself about breastfeeding comes in. But you need to define your own success. Okay, so I used to call the following successful breastfeeding, but since we are going to define our own success, we rather call this elements to facilitate exclusive breastfeeding. So here are some elements to facilitate exclusive breastfeeding. A bit of planning or preparation, which includes all these things. Lots of milk, which is a whole list of conditions we will look at now. A deep and comfortable latch from baby, and remember the real learning of breastfeeding will only start once baby is finally in your arms, because learning to breastfeed without a baby is like learning to drive without a car, but we all need a learner's license before we can practice in a car. Anyway, another element is maternal confidence, and your confidence is influenced by your personal experiences, your personal expectations, your self-perception, feedback from others, a supportive environment, being satisfied with the birth experience. So see why it's so important to choose your baby's place of birth very carefully. And we need all of this in a bowl of support. So someone once said that the single most important factor in establishing successful breastfeeding is the volume of milk produced in the first 2 weeks postpartum. So if things do get off to a bumpy start, protect the milk supply while working on getting baby back to the breast, and seek help from a qualified lactation consultant, like an IBCLC. So let's look at lots of milk. So for lots of milk, we need, and this is what we start with, sufficient milk-making tissue and intact nerve pathways and ducts. So we need functioning anatomy. So think surgery, injury, breast development, all these things could have an impact on milk-making tissue. Then we also need adequate hormone and hormone receptors. So we need functioning physiology. So think thyroid, insulin, prolactin, oxytocin. And if you have any concerns, now that I've mentioned the direct influences on milk supply, please chat to a lactation consultant. And then the things that we do that impact milk supply, adequate, frequent, and effective milk removal and stimulation. So this is the management of breastfeeding. So the mother and the baby are role players here. So from the mother's side, how long is the feed, how often baby feeds, how she brings baby to the breast, and then from the baby's side, their ability to remove the milk effectively. We also need adequate lactation critical nutrients. So it's rather about what we eat than what we should avoid. But the basic guide is anything goes, but moderation is key. So this is during breastfeeding. It's a different story during pregnancy. And also please see babies, your own doctor, sorry, see your doctor, or yeah, if you have issues with something like thyroid or iron deficiency, etc., and see a dietitian to help you figure out which food can help boost your milk supply if it's needed. Okay, so we also need no other lactation inhibitors. So, for example, the effects of medication on milk supply, smoking, alcohol, too much peppermint, too much parsley, sage, rosemary, and thyme. This sounds like a Simon and Garfunkel song. And then when we all add all this together, then we get a good milk supply. Okay, now that we have decided on your breastfeeding goals and you have an idea of what successful breastfeeding means to you, I suggest make a commitment to your baby to breastfeed. So breast milk is all a baby needs for the first 6 months of life. If you are healthy and baby is born full-term and healthy and you are eating a well-balanced diet, through breast milk you will provide your baby with all the nutrients he or she will ever need for that first 6 months. So there's no extra supplements or water needed for the baby. So deciding to breastfeed is really not just a lifestyle choice. It's a healthcare decision, and affordable and attainable healthcare begins with breastfeeding. Someone also once said that from a nutritional, immunological, digestive, neurological, developmental, mental, psychological, and emotional standpoint, there is no replacement for breast milk and human milk, or breastfeeding and human milk. So make the decision to give your baby the best start in life, and you can download a few points on the importance of breastfeeding for the baby and the mother from the link below. Okay, so now that we have decided, or you have decided on your breastfeeding goals and you have made a commitment to breastfeed, I just want to mention that the suggestions to follow doesn't necessarily have to happen in the order that I am mentioning it or presenting it. Just make sure that you try and cover it all before the baby is born. And you may wonder what all this has to do with breastfeeding. Well, my introduction, it takes a village. Breastfeeding is not the mother's responsibility alone. So the suggestion is that if you are going to be a working mother, is to talk to, or rather with, your employer while you are still pregnant. So negotiate with your employer time and a place and a way to breastfeed or express. If you have a human resource department, or if you are a member of the union, maybe check their attitudes and knowledge of breastfeeding practices or policies. Most South African companies do not have a workplace lactation program, but maybe you can start one. Now, as you may know, the South African Code of Good Practice on the Protection of Employees During Pregnancy and After the Birth of the Child, which forms part of the Basic Conditions of the Employment Act, stipulates that arrangements should be made for employers who are breastfeeding to have breaks of 30 minutes twice a day for breastfeeding or milk expressing each working day for the first 6 months of the child's life. So beyond 6 months, the code suggests breastfeeding women should engage their employers to make arrangements to support breastfeeding. But the code is just a code. The code is not legally enforceable. It is just a guideline to employers on issues of maternity protection, and it depends on the relationship of the employer with the workers for them to actually implement it. And since the guidelines are not legislated, no formal monitoring and enforcement mechanisms exists. Sorry. Right. Another suggestion is to help yourself, to set yourself up for success, is to educate yourself and your partners and your other main support about breastfeeding and the impact of birth practices on breastfeeding. Now, because breastfeeding is the natural way to feed a baby, nature takes care of most of the preparations for you naturally during pregnancy, which is the growth of the milk-producing parts of the breast. So at one time, a great deal of importance was placed on preparing your nipples during pregnancy, but these practices, they included things like massage and stretching and toughening the nipples, or wearing breast gels or applying special creams. But we know now that these techniques are not effective and they are not necessary. Remember, nature takes care of most of the preparations for you. So your body will prepare the breast for breastfeeding, and prepare your nipples for breastfeeding. It's also now recognized that comfortable positioning and a deep latch from baby, though that's the best prevention for sore nipples. Okay, so what can you expect before the baby is born? Signs that your body is preparing for breastfeeding include your breasts will likely get bigger, and become heavier during pregnancy, which creates an additional load for the supporting ligaments. So pregnancy usually changes the way the breasts look, not breastfeeding. Some women may develop sagging breasts along with other changes. So breasts need support, and wearing a bra throughout and after pregnancy can counteract gravity's effect on them and may help against sagginess. So just ensure the bra fits properly and provides the support needed. You may also notice more or darker veins on your breasts. It's the increased blood flow that makes the veins in the breast appear darker. And some people may notice stretch marks appearing on the breasts as they grow during pregnancy. And this happens due to the quick growth of the breast and is influenced by genetics and hormonal factors. Your breast may also feel tender, and the nipples may become sensitive to touch. So around 16 weeks, your body already begun making colostrum. Colostrum is that nutrient-rich fluid produced by female mammals ready for consumption by her newborn. And some women may notice colostrum leaking and some may not. And whether you leak during pregnancy has nothing to do with how much milk you will make for your baby. Some women may also notice their Montgomery glands, that little bumps on the areola, becoming more noticeable during pregnancy. Now, areola is not a Disney princess, it's the skin surrounding the nipple. Anyway, the Montgomery glands on the areola secrete an oily fluid to keep the skin healthy and clean and lubricated. And they are also part of the source of smell for the mother's breasts during helping the baby find the breast after birth. So to protect the natural oil secreted by the glands on your areola, mothers should ideally use no soap and no alcohol and no antiseptic or any other agent on the nipples. So when washing your body, you can just use plain water over the nipple area. And as a good guide, If you are not prepared to put it on your lips, don't put it on your nipples. Oh yes, also some mothers may notice that the areolas are getting darker. So the darkening areolas during pregnancy are likely the result of hormonal changes. And often the areolas return to its pre-pregnant color after breastfeeding, but it sometimes remains a shade or two darker than it was originally. Now, antenatal treatment of presumably flat or inverted nipples are, according to the World Health Organization, not helpful and can have risks, causing a mother to doubt her ability to breastfeed exclusively. So most nipples become more protracted, that's extending forward and outward, and pliable as the pregnancy continues without any treatment. So just chat to your lactation consultant if you have any concerns. The bottom line is there's not much preparation that you have to do in terms of your breasts and nipples. What you can do is to get your mind ready for breastfeeding. So the World Health Organization says that all pregnant women must have basic information about breastfeeding in order to make informed decisions. So your antenatal education should include information on the importance of breastfeeding, the impact of birth practices during breastfeeding, the importance of skin-to-skin contact immediately following birth, how to recognize when babies are ready to breastfeed, the importance of feeding on demand, or rather cue or responsive baby-led feeding, positioning and attachment of the baby for effective suckling, importance of rooming in, how to ensure enough milk, um, how how to know your baby is getting enough milk, possible challenges such as engorgement and a perception of not producing enough milk, and how to address them, and where to find breastfeeding help. So by the time the baby is born, you will be comfortable about breastfeeding and be confident about what you need to do. So just note that antenatal or any breastfeeding education should not include group education or formula preparation or bottle feeding, because that needs to be done one-on-one with parents who are going to or need to prepare and give their babies breast milk substitutes. So at a minimum, knowing some main points about positioning and attachment can help breastfeeding go well. So educate yourself by attending antenatal classes, reading good books, or is it blogs? And please don't believe anything or everything you see on TikTok or Instagram. Rather talk to breastfeeding mothers or attend La Leche League meetings, etc. Now, pregnant mothers who attend La Leche League meetings can witness breastfeeding in action. Now, although your body and your baby, because it's the baby who is breastfeeding, not the mother, will be doing most of the work of breastfeeding, keep in mind that there may be about a 2-week learning period after birth when interactions between mum and baby and mum's body runs more and more smoothly. So please do not give up in the first 2 weeks. Seek help if things are not working. Now some nice sites to check out for breastfeeding information are La Leche League International's website at ll.org/breastfeeding-info. It contains information on topics of interest to breastfeeding and parents and breastfed children. So Kelly Mum is another amazing resource, and also check out breastfeeding.support and watch the free breastfeeding class series on YouTube. Just go to breastfeedingsa.co.za. Right. So another suggestion to help set yourself up for breastfeeding success is to decide where baby will be born. So usually when I ask mothers with a private medical aid, how did you decide on a specific hospital? Mostly their answer is because that's where my gynae is. So getting breastfeeding off to the best possible start means choosing normal birth and selecting caregivers and a place of birth that promotes, protects, and supports normal birth. Some interventions that could interfere with breastfeeding includes things like inductions, augmentations of labor, vacuum and forceps deliveries, cesarean birth, pain relief medication, mum and baby separation after birth, and then after that not rooming in, baby oral insult, which is suctioning of airways, the use of dummies, unnecessary supplementations, and the list goes on. So, and then we might end up with consequences like a delayed onset of breastfeeding. It takes longer for breastfeeding to establish. Babies developing a disorganized suck or having a diminished sucking response. and perhaps a delayed lactogenesis too, meaning it takes longer for the milk supply to increase, and you might know this as milk coming in. Now, even having had all these interventions, your baby might manage to breastfeed just fine. So I'm also by no means saying that you will have no problems if you have a vaginal birth, but the fact remains that normal natural birth sets the stage for problem-free breastfeeding, what nature intended, while complicated intervention-intensive labor and birth sets the stage for problems. So this is why we have lactation consultants to help babies overcome the possible results of our interference with nature. Now, good news is nature wants us to succeed. Lactation is not as fragile as many people think, otherwise the human race would never have survived. So please do not think that all is lost because baby doesn't latch and feed like a champ from the get-go. Now, a baby-friendly hospital aims to create healthcare environments which helps mothers acquire necessary skills to exclusively breastfeed. And the 10 steps to successful breastfeeding, which is the foundation of the BFHI, summarizes the practices and policies necessary to support breastfeeding. And these are the 10 steps to successful breastfeeding. You can pause this recording and read through it if you want to. The 10 steps are also included in the birth plan handout. So another suggestion after deciding where baby will be born is to write a birth plan. A birth plan can help minimize interventions during labor and birth, which I have mentioned before, and it can help minimize its effect on breastfeeding. So a birth plan can be a starting point for discussion with your healthcare provider and the facility where you will give birth. For example, what you would like to have that you would like to have your baby placed skin to skin on your bare chest immediately after birth. And you can also do this after a cesarean birth. Just ask your medical staff for extra support to place your baby safely on your chest. And you can download a sample birth plan for a vaginal birth and a cesarean birth from the link below. Also consider hiring a doula. It helps minimize the interventions and the consequences of these interventions. And you can find a doula at one of these sites, WOMS or Mama Bamba. Right, the last suggestion that I have for you is to develop a family postpartum plan, which will include the all-important support. And you can download a sample of the family postpartum plan from the link below. So a family postpartum plan can be a starting point for you to think about how to adjust to life once baby arrives. And to have time to develop your and baby's breastfeeding relationship. And yes, breastfeeding is a relationship. So instead of thinking about breastfeeding as a skill to master or a measure of your worth as a mother, think of breastfeeding primarily as a relationship. Anyway, birth takes only a day, but it is one of the most profound life changes a person will ever undergo. So it's having the baby that causes the changes, not how the baby is fed per se. And many people think that it's breastfeeding that is causing difficulty, when in fact it may be that parents are having a difficult time transitioning to life with baby. So the goal of a family postpartum plan is to identify resources before they are needed, to reduce the stress and just ease the transition period to help breastfeeding fit into your life. So some keys to a happy and healthy new life with a breastfeeding baby are rest, nutrition, support, self-care, feeding support, self-care, social support, support with health and family, mental health, which may involve the need for professional health support. And if I want us to just have a quick look at each of these. Let's start with rest. So, getting sufficient sleep may be the most challenging obstacle for new parents after the baby arrives, but it is one of the few important things a parent can do to stay physically and emotionally well. Breastfeeding mothers can practice safe co-sleeping to help get enough sleep. And I suggest in the early days to not entertain visitors in the afternoons. sleep in the afternoons with your baby to gain strength to cope with your little night creature. Um, so during the first few days, many babies may be more awake at night and less awake during the day because mothers have been rocking them to sleep for 9 months during the day. And most mothers will recall babies in utero waking up at night when the mother got into her bed. She would have felt her baby kicking and moving more. So babies are still in the rhythm of being more awake at night and sleeping more during the day. Most babies switch by 2 weeks of age, just eating and sleeping at night and being more awake between feeds during the day. So planning ahead is key. Ask yourself, who is available to help during the day? Who is available to help during the night? Are there people available to help during the dinner and early evening hours? Next is nutrition. So you may be surprised to find out that simply going to the store or even figuring out what to eat can seem overwhelming in the first weeks. So you can plan at least 2 weeks worth of meals ahead of time and do as much food shopping in advance as possible. Focus on eating high protein, nutritious foods that you can grab and eat on the go, such as yogurts and cheese, meats, and pre-cut veggies and fruit. Stock up on food that is easy to prepare. If freezer space is available, make double meals now and freeze for later after birth, like soups and casseroles and stews. So think, what nutritious menu ideas are quick and easy to prepare? What grocery stores or which grocery stores offer online shopping and delivery? What nutritious takeout or delivery options are available? Which of your friends can prepare and deliver meals after the baby arrives? And if someone wants to give you a baby shower, maybe ask for a food shower. The guests can bring ready for the pantry food or maybe for the freezer to use after baby is born. And when friends ask how they can help, just say a main dish would be lovely. Okay, now feeding a new baby can be a full-time job, and it can be challenging in the initial days when trying to figure out how or what works best. So we need to know what is normal and when to seek help if it's not. And family and friends can be a great source of support and encouragement. Local postpartum doulas could visit and help, but make sure now you have the name of a knowledgeable breastfeeding person like a certified lactation consultant or a lactation leader or a breastfeeding peer counselor if you need information or help to overcome any breastfeeding issues. So for breastfeeding support in your area, you can go to laxa.org.za or llsa.org or the Peer Counselor Wix website. And these links are also in the handout. So new mothers all over the world breastfeed without any equipment whatsoever. As mentioned, the mother's body comes with everything needed for breastfeeding. However, some of the following might make the early days of breastfeeding more comfortable, and these include a pillows, lots of pillows, rest time, and patience. Other items which may help to make breastfeeding easier include clothing that will allow easy access to the breast, like roomy tops or t-shirts. And for going back to work, choose a work wardrobe with a breastfeeding baby in mind, like two-piece outfits that gives easier access for expressing and breastfeeding. And maybe select prints and loose-fitted blouses that can camouflage possible leakage. Okay, so another item to buy is a bra that is easy to manage with one hand. Many mothers find it more comfortable to support their breast with a bra, but avoid those with an underwire, which can cause pressure and result in blocked ducts. And maybe get one that is roughly 1 cup size bigger than your normal bra. The centimeters usually stays the same. So your breast may go up a full cup size when your milk supply increases around day 3 or 4. So the bra should have room for expansion. So ideally a breathable fabric are best for breastfeeding. So consider maybe buying 1 or 2 breastfeeding bras during the final weeks of pregnancy. Breast pads, commercial or cotton, could help with those early day leakage. but you won't know if you're going to leak before the milk supply increases. Some mothers leak and some don't. And milk supply usually stabilizes between 6 weeks and 3 months, so maybe you won't leak after that. Some people also set up a breastfeeding corner at home with your favorite chair, which is often a rocker, which should be comfortable with a firm back support, maybe slightly reclining, and your feet should be well supported on perhaps a footstool. Although I want to say that laid back breastfeeding in your bed is preferred for the first 2 months. Also nearby a table which can hold a few key supplies like something to eat, healthy snacks, something to read, some water or juice, etc., soft light, soft music, etc. And then a baby carrier or sling can help free up your hands between feeds. Now, note that to help with exclusive breastfeeding, there are no bottles or dummies involved. So many so-called breastfeeding starter kits, probably commercial, includes definitely commercial. Breast pumps and silicone breast pumps, which is not really a pump, it's a collector, which we now worry may add to sore nipples and oversupply. Anyway, they also include in these breastfeeding starter kit packs bottles, dummies, lactation cookies, nursing teas, nipple creams, hot and cold therapy packs, and we will unpack all of this now. Now, I'm not saying that you're not allowed to buy these. It's just that these things can, in a very sneaky shop psychology way, make you doubt your supply and your ability to breastfeed. Now, with the breast pumps, you may wonder about buying a pump now. Your antenatal preparation should ideally teach you how to express milk by hand, because if you need to obtain milk for the baby in the first 2 days or so, if you're going to try and express with a pump, you will lose your valuable colostrum in the pump. So you'll need to hand express first. You could apply the pump for stimulation after hand expressing the colostrum if baby is not feeding well yet. So I would suggest, if you have to go back to work, to start saving up now, but please talk to a lactation consultant first, not the shop assistant, about the best option for you, the pump specs, when to start expressing, pumping basics, milk storage guidelines, etc. There isn't a rule to say that you are not allowed to pump in the first 6 weeks. Ideally, baby should be building the milk supply, and expressing could cause an oversupply, but if supplementations are needed, then obviously you would need to express and supplement the baby with your own milk, depending on the situation. Okay, about bottles. Please don't buy bottles now. Also, ask people not to gift you bottles at the baby shower, because how is giving a bottle to a mother who intends to breastfeed going to help her confidence? If your baby will be cared for away from you, speak to your lactation consultant first before buying bottles. Speak to her about the type of bottle, the type of teat, paced bottle feeding for your breastfed baby, etc. Dummies. Now, the suggestion is to not give your breastfed baby any artificial teats or pacifiers, dummy soothers, while you are trying to establish a milk supply and your baby's breastfeed. So the big worry about using pacifiers is that it may interfere with the mother's ability to recognize feeding cues. And if a hungry baby is given a pacifier instead of a feed, the baby suckles less at the breast, takes less milk, and may not gain weight as well. So, and also because of less suckling, there is interference with the establishment of milk supply. Now, babies who use pacifiers, they breastfeed less in 24 hours because suckling causes the secretion of a hormone called cholecystokinin, which makes the baby think they are full. So please hold off with the dummy until breastfeeding and milk supply is well established. You can let baby suck on your finger if mum is temporarily unavailable. A baby will latch beautifully on an adult index finger with their tongue cupping the finger and extending over the bottom gums like with breastfeeding. Okay, lactation cookies and nursing teas. So many mothers feel that lactation cookies and nursing teas have helped them, though there is limited scientific evidence that the ingredients in lactation biscuits or lactation cookies or breastfeeding biscuits or whatever will boost a mother's milk supply. And often the mother needs to consume a large quantity of the nursing tea or for the herb in it to have an effect. Now, it may help because it nourishes the mother and makes her feel good. And if the mother feels good, her body would be in a good place to make milk. So it is worth highlighting that many lactation consultants are concerned that the mother who suspects a low milk supply may choose to just try lactation cookies instead of going straight to a lactation professional for help. So I'm not saying that you are not allowed to use these products. It's just that often these things undermine women's confidence and could ultimately affect breastfeeding negatively. So nipple cream, now though many mothers swear by this or that brand, saving their breastfeeding journey, and great if they feel that way, the fact remains that an ointment is not a substitute for a deep and comfortable latch, and a mother should not apply any substance to her nipples that would be harmful for the baby to take into the mouth, that which requires removal before breastfeeding, and which can sensitize the mother's skin and make nipples more sore. So there's so much conflicting information out there about lanolin ointments and hydrogel sheets and silver caps. It's really hard to keep up with what really works according to research and what works according to the manufacturers of these products. So the easiest and cheapest is to smooth expressed milk over the nipple after feeds and just let it dry before putting on a bra. And it's free and it's research-based that it works. So something else you may be wondering about is the use of nipple shields. Now, nipple shields is a hotly debated topic, largely because we have very little data on how nipple shield use affects long-term breastfeeding success. And a mother should not use a nipple shield as a routine measure because nipple shields comes with terms and conditions. So please talk to a lactation consultant if you consider using a nipple shield. And then the hot and cold therapy packs. Again, you don't necessarily have to buy something fancy. You can just use stuff you have at home. So for engorged breasts after feed, putting a cold compress on the breast will help to reduce swelling and pain and inflammation. A cold compress could be a cool, wet face cloth or some raw green cabbage leaves placed inside the bra on the skin or the affected area. Or you can use a bag of frozen peas or crushed ice in a bag wrapped in a towel to not burn your skin. Some mothers like to apply warm before breastfeeding to assist milk flow, although after feeds and for any inflammation, the cloth or any type of compress used is cold because cold will decrease blood flow, it will decrease swelling, and then the milk can flow. So all in all, you can see all you really need for breastfeeding is a baby and breasts. And of course, someone to provide support and encouragement. That will also help. Right, let's take a look at self-care. Now, new parents need time to take care of themselves and nurture their relationship as a couple, which is not always easy when adjusting to life with baby. So ask yourself, what can you do to rejuvenate yourself? And what can you or your partner do, and your partner, to nurture your time as a couple? And what can you and your partner, who can you count on for occasional childcare? Social support. This is critical for reducing stress and to feel valued and cared for. So make sure you have a support network ready. It could include LHD group meetings, relatives and friends that support breastfeeding, or find a support group that meets your needs, like postnatal fitness classes or online discussion groups or virtual support meetings, something like that. And then support with house and family. Now, a new baby needs almost constant care for the first weeks, and if parents are going to try and do it all, they will not get enough sleep. So it may help to put away non-essential items that require labor-intensive attention, such as ornaments that need dusting or toys that need parental supervision. And if friends offer help, say yes. Maybe keep a list of support team members and reach out to them for help. So, who can you include in your support team? Grandparents, friends, sister, church members. Also, identify things that can be delegated, or make a list of chores for when parents ask how they can help. It's like taking care of older children, shopping, running errands, preparing, providing meals, washing dishes, doing laundry, light cleaning, etc. Taking care of the baby, that is reserved for baby's parents, not for other people. And maybe put this "we'd love your help" or something similar on your up on your front door. And there's a sample in the postpartum family plan handout. To help make life easier with older children, maybe read to older children while breastfeeding. Tell stories of when they were babies. Um, I used to have a breastfeeding toy box, so every time my baby boy wanted to feed, his sister was allowed to play with the things in the breastfeeding toy box. Maybe also provide healthy snacks for older children to eat while the baby is feeding. And keep toddlers and preschoolers within your view. Maybe block off rooms that you cannot supervise while attending to the baby. And ask family members or a friend to look after older children occasionally so that you can sleep and rest with your baby. Most people will be truly happy that they were asked. And then lastly, mental health. Now, we don't really need research to tell us that a positive breastfeeding experience can be an amazing boost for maternal mental health. That being said, perinatal mood and anxiety disorders is the number one complication of pregnancy and childbirth. So PMADs are a spectrum of emotional complications that can affect expectant and new parents at any point during pregnancy or the first year after birth. So medical professionals can play an important role in assisting women to recover from perinatal mood and anxiety disorders. So just ask your healthcare provider about the depression screening tools, like the patient health questionnaire or the Edinburgh postpartum scales, and these screening tools are also included in the handout. Okay, so to help you prepare for breastfeeding while you are still pregnant, we have looked at what are your breastfeeding goals, making a commitment to your baby to breastfeed, talking with your employer, educating yourself and your partner and your main support about breastfeeding, deciding where baby will be born, writing a birth plan and hiring a doula, and thinking about a family postpartum plan and surrounding yourself with a network of people ready to support you in breastfeeding. So thank you for listening to this talk. I hope that you have some ideas on how to prepare for the best journey of your life. And remember, if you would like to watch a free breastfeeding class series on YouTube, just go to my website and navigate it from there. All the best with the rest of your pregnancy.